Fertility New Zealand is proud to host Fertility Week. Fertility New Zealand is a registered charity which provides support to New Zealanders faced with fertility issues. We provide information such as through our website and brochures available in all clinics in New Zealand. We have support largely provided by a volunteer network around the country in 10 different locations. They run regular groups. And we also provide advocacy, such as lobbying the government on issues related to fertility. So tonight's webinar will involve a presentation of around 20 minutes, followed by a chance for questions and answers. If you have questions at any stage during the presentation, please just type them into the question box to be moderated, and then Jo will either answer them during the presentation or she'll save them to the end, depending on how it's going. So I would now like to introduce to you Jo Barnett, who is tonight's speaker. She is a registered medical herbalist operating in Christchurch, Director Natural Fertility and Women's Health, and she's also an executive committee member of Fertility New Zealand. Thanks very much, Jo. Over to you.
Thank you. Hi there. Welcome this evening. So we're going to have a wee look this evening at how you can help yourself with making babies, I guess, and just a lot of the self-help things that you can look at doing. Starting on a fertility journey can be very daunting and overwhelming, particularly when you're faced with the statistics of, 1 in 4 New Zealanders are experiencing fertility issues. Oops, hang on, we've got a moderator thing in the middle of our screen. Hang on a second. So couples armed with an awareness and knowledge of their menstrual cycles and fertile times, as well as 4 months of preconception care, will have a much better chance of falling pregnant and having a healthy pregnancy and baby. So this approach will benefit anybody planning a pregnancy, whether they have fertility issues or not. In fact, we really encourage all couples, when they're thinking about planning for a child, to look at doing at least some preconception care before they actually embark on creating that child. So also couples or singles that might be experiencing delays in conceiving or maintaining a pregnancy, or if you're undergoing any fertility treatment or looking at donation or surrogacy, you will all benefit from preconception care. So preconception, pregnancy, and those early years are all very key periods in which healthy lifestyle choices can have a huge positive influence on the mother and the child's lifelong health. So good nutrition and moderate physical activity can help to reduce the risk to the mother and the child of developing diseases like diabetes, heart disease, obesity, and some cancers later in life. And it's achievable, all cultures and family situations, healthy eating and exercise should be achievable. It doesn't need to be hugely costly or complicated, and those lifelong benefits are invaluable. Preconception care aims to achieve the optimal general and reproductive health of both partners, and I do emphasize both partners because you're contributing 50% each. We're looking at to enhance your fertility. We're also looking at enhancing the health of the egg and the sperm, and ultimately the healthy development of your baby. The preconception period is a minimum of 4 months prior to conception, as the maturation of the egg and the sperm takes 100 to 120 days. And research has found that good or poor nutrition and physical activity can drive epigenetic changes that have lasting effects across the health of at least 2 generations. And I mean, this is where, obviously we want you to get pregnant, but you can also have an impact across 2 generations on the health of children. Because the fetus takes its cues from the uterine environment to prepare itself physiologically for the rest of its life. But in this uterine environment, it's conditioning not only the fetus, but also the cells which give rise to your fetus's sperm or eggs. And that's how you get that impact on the health of subsequent generations. So looking at preconception care, I guess I look at it at fertility, or dealing with fertility issues, as kind of like one of those old-fashioned pie graphs we had at school. And there's numbers and numbers of things that can have an impact on your fertility, and some have a huge impact, some have a minimal impact. But particularly when you're faced with fertility issues, we try and tidy up as much as we can to get, hopefully the best outcome for you. So the first thing that you need to look at is understanding when you're fertile, and I'll go through all these in a bit more shortly. Looking at eating a balanced, nutritious diet, avoiding alcohol and smoking, managing your weight, addressing the use of prescription and non-prescription drugs, regular moderate exercise, reducing your exposure to environmental toxins, addressing and managing stress, and then particularly if you're seeing a practitioner, you'll be looking at additional nutritional and herbal support as needed. So if we look at the first topic, when are you fertile? I find it staggering that 85% of New Zealand women cannot identify their fertile window. This is something really that should be almost taught in school, so that girls, grow up understanding their cycles in their bodies. So couples, obviously, if you're more aware of your fertile times and having intercourse at this time, then you're more likely to conceive. So that's like the first thing we should be looking at. Do you understand when you're fertile, and are you having sex at the right time? And even just an understanding and awareness of this will give couples a greater sense of control over their situation. So what do we sort of look at there? By checking and recording your cervical mucus, your body at rest temperature, and your body symptoms, it helps to give you a picture of when you're fertile. And I mean, I love it when people do it on paper and we have a nice big chart, but a lot of people are using fertility apps and things like that. And I think as long as they're giving you space to record all your symptoms, and particularly mucus recordings, and that's whatever works for you is fine. So the fertile window is determined by the lifespan of the sperm in the female reproductive tract, and then the life of the egg once it's been released at ovulation. So sperm live for 3 to 5 days, and the egg survives for 12 to 24 hours, although there is some evidence that egg quality declines 6 to 12 hours after ovulation. So having sex prior to ovulation, so you've got the sperm there ready and waiting for the egg when it's released, is pretty important. And even just looking at that piece of information, it's pretty amazing people get pregnant at all. So studies show the maximum fertile window includes ovulation and the 5 preceding days. So the most probable days for intercourse to result in a pregnancy are 1 to 2 days before you ovulate. And I'm sorry, but the quality of the slide isn't that great, but I just think it's really good to have a bit of an understanding about what's happening. On the right-hand side, and I don't know if I can put it here, so you've got, this is the cervix coming down, and just sitting in the neck of the cervix, we've got this thick plug. So this is what is happening in your body when your estrogen is low at the beginning, just after your period, and at the other end of your cycle. So you've got this big, thick, almost like a plug or a natural diaphragm, which is stopping the sperm from penetrating through. When you're fertile and your estrogen levels risen just before ovulation, it breaks up that plug, and then sperm can swim through. And if we look at this next slide, if we were to look at your mucus, again, sorry, the quality is not that great, but if you were to look at your mucus under a microscope, the mucus at the beginning of your cycle, just after you've menstruated, looks thick and dense, and there's just no way that sperm can swim through that. It's a great physical barrier. For contraception, it's really good. And then as your estrogen levels start to rise, as you are heading towards ovulation, this big plug will start to break down, and you can see here that there's a pattern emerging. There's channels opening up, but the sperm gets stuck in there, or if they are lucky to get enough to get through, I think they'd have a very sore head. And then once you get close to ovulation and your mucus becomes fertile, your estrogen's high, that mucus plug the mucus creates a lovely ferning pattern, which actually helps to channel the sperm up on its journey, but it also acts to protect the sperm from the acidic walls of the vagina. So mucus is pretty cool stuff, and you cannot get pregnant without it really, unless you're using IVF or similar things. So the nature of your cervical mucus tells you when you're approaching ovulation, right? So that mucus release is stimulated by the rising levels of estrogen, which peak just prior to ovulation. Your fertile mucus is wet, slippery, or a bit like raw egg white, and it's usually very plentiful. And sperm needs this, okay, in order to fertilize the egg. Oops, bear with me a second. Go on to the next slide. So periods of abstinence just prior to conception for longer than 3 days allow aged sperm or potentially damaged sperm to accumulate. So we don't want that situation happening. So you want to kind of ejaculate or clear out about 3 days before your conception attempts, and then allow the count to build up for 2 to 3 days, and then use that fertile mucus to help transport the sperm. Other things that we use, again, to help work out when you're fertile, I think often we record temperature and ovulation kits. So ovulation kits help to identify ovulation, but when they give a positive result, the fertile window is nearly over, and they don't work for everybody. Some people find they're brilliant, other people, it just doesn't seem to work, and I don't really understand why that is. Basal temperature, like recording your body at rest temperature, and first thing every morning, confirms. We use that to confirm that ovulation has occurred. So that, I guess, mirrors a wee bit what progesterone is doing. So it's not so useful for conception timing, but it is really useful in helping to build up a picture of your fertile patterns, and also to give us a bit of an idea of what your progesterone levels might be doing. Are they holding up in the second half of your cycle, or are they going up and down? And just sort of checking that your temperature rise is sort of working in line with your mucus. Okay, so that's, timing of sex in a nutshell, really. I mean, we could talk for hours about all of these things. So tonight I'm just having to sort of glaze over things very quickly. So moving on to nutrition. Eating a healthy whole food diet in that 3 to 4 months preceding, and obviously during pregnancy as well, is really important for reproductive and general health, and for the health of your future child and your pregnancy. And recent research strongly suggests following a Mediterranean-style diet increases, and that really does seem to increase your chances of conceiving each month. Oh, sorry, let's move on to the next slide. So I'm not fond of diets, but I like to, give you general dietary guidelines for, for what would be ideal for you to be looking at doing. So the first thing is to make sure you're getting adequate, good quality protein. So whether it's fish, chicken, eggs, dairy, lean red meat, legumes, pulses, nuts and seeds, that kind of thing. But you want a good variety is great, and a really good rule of thumb is to have 1 serve with each meal. And I guess another very simple rule of thumb is to have, when you're serving your plate, you want it to be very colourful. You want at least half to be vegetables, a quarter protein, and a quarter carbs, whether they're in good quality carbs too, which I'll talk about in a second. Sorry. So you want to avoid or reduce saturated and trans fats, but you do need to ensure that you're getting good sources of healthy fat. So in a good quality extra virgin olive oil and other unheated vegetable oils, nuts, seeds, and avocados. You want to reduce or preferably avoid sugars and refined carbohydrates, and make sure you're getting good amounts of whole grains. You want to stay away from processed foods, so things that are high in sugar, salt, additives, colorings, flavorings, preservatives. So, just really trying to cook from scratch and stay away from grabbing those, quick serve jars of this and that from the supermarket. Lots and lots of antioxidant rich foods, particularly vegetables, like tons. I cannot emphasize, eat as many vegetables as you possibly can. You cannot just get enough vegetables in by eating them just at dinner time. You really need to try and eat them over the day as well. And then 2 or 3 pieces of fruit a day, because we don't want too much fruit because of the high sugar content. Make sure you're drinking plenty of fresh water, or herb teas is fine, and try and stay away from caffeine, soft drinks, energy drinks, that sort of thing. Rolling right onto alcohol now. Alcohol consumption does decrease fertility and increase your miscarriage risk, and high levels can result in fetal alcohol syndrome. But World Health findings haven't really established how much alcohol is okay, but with even small doses during a pregnancy can affect the child's cognitive development. So it's really a good one to stay away from. And the most vulnerable time for a child is in those first few weeks after conception, when often pregnancy hasn't been detected at all. So again, it's another reason why, trying to avoid alcohol preconceptually is a really good idea. And, if it's really too hard to avoid alcohol, it's probably better to have no more than 1 unit in 24 hours than to go and have a big binge at the weekend. So that we're thinking that the binging stuff is probably worse than small amounts of regular. But again, I would really strongly recommend avoiding alcohol. And caffeine, several studies have shown that 300 milligrams of caffeine a day increases the time to conceive and increases the risk of miscarriage or stillbirth. And some studies have found an adverse effect at lower doses than that. It can also, excessive amount of caffeine can reduce and retard the quality of the sperm produced as well. So 300 milligram of caffeine is about 3 cups of coffee, 3 to 6 cups of tea, 10 cans of cola. That sort of gives you an idea of how much caffeine's in each of those things. So really, ideally avoid caffeine or limit to a maximum of 2 cups of coffee a day. Weight. Again, there is good, strong evidence fertility for males and females is affected by being significantly over or underweight. So it is recommended that people aiming to conceive naturally or with some help maintain a healthy body weight with a BMI between 20 and 25. And women with a BMI of more than 32 must lose weight in order to become eligible for publicly funded fertility treatment in New Zealand. On the other hand, low body weight can be a problem as well because that can impact on and prevent normal ovulation, but it can also reflect poor nutritional status, which as well will impact on the health of the pregnancy and baby. Exercise, a very important thing. So we're looking at regular, moderate exercise. So, a bit of I'd say an hour 3 times a week, or, you can mix that up however it's for you. But that can benefit your overall physical, emotional, and general well-being, which is going to have a positive impact on fertility. Excessive exercise can also negatively affect fertility in both men and women. And this is a bit of a guideline. Some people will get away with doing more, but greater than 4 hours a week of really intense cardiovascular exercise is possibly pushing it out there. But, everybody's a wee bit different and we can tolerate there. But men, be really mindful of excessive exercise, particularly if it's increasing your testicular heat, okay, such as cycling, okay, because that can impact on your sperm health. Your scrotum is designed to be several degrees below core body temperature for normal sperm production, and that's why they dangle down. Increased scrotal temperature can really hamper sperm production and quality. So men, to protect your fertility, avoid tight underwear or athletic shorts or prolonged periods of time in wetsuits. And if you do bike or remain seated for long periods of time, take frequent breaks. And if you do have, sometimes, if men have big, issues with their sperm, we do suggest avoiding cycling, full stop. And stay away from hot tubs, saunas, and really hot steamy baths. Recreational drugs. Marijuana is one of the most commonly used recreational drugs. It can cause abnormal reproductive function. Cocaine and heroin likewise, and we don't know much about synthetic drugs such as P, but they're not going to be great. In fact, I can't see how they'd be good at all. Cigarette smoking is associated with lower fertility rates. It halves the chance of pregnancy each month with a natural conception and IVF. Smoking is a major cause of preterm births and low birth weight babies as well, and it's also associated with an increase in spontaneous abortions. So women who smoke are ineligible for publicly funded treatment or even to go on the waiting list. So both prospective parents should stop smoking at least 3 to 4 months before any conception attempts. And if you're someone who needs science behind making decisions like this, there's good science behind this. If you're on prescription medications or you're needing any, you need to discuss with your GP the impact that they might have on your fertility. And always err on the side of caution, okay, and consider alternatives where you can. Sometimes you can't avoid things, but if there is another option, then definitely consider it. Obviously, chemotherapy drugs, radiation treatment for cancer can cause permanent infertility. So for men, there's that possibility of retrieving and storing sperm before treatment. In fact, women, eggs can be frozen and stored, but I think it's a bit of an expensive and tricky and painful process. Calcium channel blockers, tricyclic antidepressants, a lot of anti-androgens and steroids can all contribute to fertility issues. And then moving on to environmental factors. Sorry, I know we're racing through here. You want to avoid environmental toxicity as much as you can in your work environment and your home environment. So chemicals that you're just exposed to daily will include things like cleaning products, cosmetics, hair dyes, not just the big, industrial pollutants. Free radicals are toxic metabolites that impair the ability of the sperm to fertilize the egg, and they can also damage DNA found in the head of the sperm. And these toxic substances are found in a number of environmental chemicals that we're very readily exposed to. You can block free radical damage by the use of antioxidants, and that can be helpful. Looking at heavy metals, things like lead, mercury, aluminium and arsenic, and a lot of people are exposed to these things in the workplace. There's lots of studies showing that these heavy metals can alter hormone levels, they can decrease overall fertility in men and women, and they're also implicated in miscarriages, stillbirths and preterm delivery. Looking at pesticides and things like that. So pesticides, insecticides, plastics is a big thing, and a lot of cosmetics can act as what we call endocrine disruptors, and they can have varying damaging effects on the reproductive health of men and women. They can create havoc because they mimic your natural hormones, and a lot of our hormone receptors aren't that selective, and so if something looks a bit like it, they bind them up, and then they can impede more hormonal activity and also the regulation and function of your endocrine system. Now I see I've got a few questions popping up, but I might deal with them at the end simply because I can't read them, the writing is too small. I'll come back to those. Radiation. So radiation is something in all its various kinds and amounts that we can't get away from these days, but can have an impact on fertility. Just some really simple things you can do is avoid placing your laptop computer directly on your lap, and men in particular, because men tend to carry their cell phones around in their pockets more than women do, try and avoid that as well. And I have many men sitting here in my clinic as I say that, and they quietly pull their phone out of their pocket and pop it up on the desk. So you really want to keep your phone out of your pockets as much as possible. Now stress, okay, it's really good. I mean, stress has many different places, and it impacts different people in different ways. Something that might stress one person is fine for another, but it's really good to have some awareness as to how stress may be affecting your personal health and your well-being and your relationships as well. It can decrease your sexual function and definitely interfere with your hormones needed to produce sperm, and also impact on the egg development and health of the menstrual cycle. So you want to try and proactively manage your stress and prioritize self-care. And I think the next webinar that comes up is addressing that emotional resilience and how you can build that up a wee bit. The things that might be helpful are things like, exercise, obviously, yoga, rest, relaxation, mindfulness, meditation, reading, just whatever works for you and helps just to bring things down a bit. Because they can all help to keep your life in balance whilst you're trying to conceive and going through often very, very traumatic times. So moving on to nutritional support, a lot of our required vitamins and minerals and amino acids, essential fatty acids and that sort of thing are obviously found in our food, but the physiologic demands of couples during preconception and pregnancy may require extra supplementation. Routinely now, iodine and folic acid are recommended and prescribed, but there's a lot of other nutrients that may be needed. I really advise seeing a nutritionist, a registered naturopath or herbalist first, to talk about the proper regime and support and testing for you and your unique situation, because there is no one fits. Everybody has got different priorities and different things that they need. But at the very least, if you can support your diet with a specific prenatal multivitamin that includes iodine before you start trying to conceive, it's a really good idea. Babies' brains start developing before you even know you're pregnant, right away. So some of the key nutrients that we look at, I think obviously folate, your B complex vitamins, vitamin D is really important, vitamin C and E, along with antioxidants, calcium and magnesium, chromium, particularly if you're someone who has blood sugar issues, iodine, zinc, iron, and we like to get your iron up high, like 80 to 100 for your ferritin before you conceive, so you've got a bit of to come because you're always going to drop in pregnancy. Selenium, omega-3 fish oils and coenzyme Q10, and that's just a few of the sort of main ones we look at. And I think the thing to remember is you can make a difference with dietary and lifestyle modification for both partners. you can not only increase your chances of conceiving, but also the health of your child and your grandchildren. And if you need help or you've got no infertility or health issues, really don't be afraid to seek out the help of a herbalist or naturopath that specialise in fertility. But do check that they're willing to work with any other healthcare providers or fertility clinics you may also need to help enable your dreams of creating a family. So improving your diet, making healthy lifestyle choices positively impacts on both male and female general and reproductive health. So create your support team and get started today. Right, and then we'll have a look at any questions. Nicola, is there any way we can make them a little bigger? Oh no, I might be able to maximise it. Should men also avoid alcohol before conceiving? Definitely. Definitely. It has a huge impact, alcohol, on your nutrients, particularly the B vitamins and zinc. And remember, you're contributing 50% towards this child, so the health of your sperm is just as important as the health of the eggs. Abstaining, is that recommended, or just retiming of sex before ovulation? I wasn't clear on the comment about abstaining. Is that recommended or not? I think it's good what we do is you get you to empty out, so about 3 days before your fertile time is due, and then let the count build up for 2 or 3 days, and then have sex as often as you want to over that fertile time. But we want to kind of get rid of the manky old ones and then let the fresh new sperm build up and use them for your conception attempt. Hopefully that answers that one. I'm 29. I've come off the pill 3 months ago, had 2 light periods, now nothing for over 40 days. How long can it take for my body to return to normal after using the pill? That is extremely variable from person to person. Some people it takes years, others it's months. Everybody is different, but it's really worth it if you're concerned. See somebody, this is probably where your herbalist or your naturopath comes in, and have a talk about what you can do to help restore your cycle as quickly as possible. Would you recommend, or when would you recommend using the herb Vitex? Chaste tree is a herb, or chaste tree or Vitex is a herb that helps to normalize a menstrual cycle. It's not necessarily for everybody, but if you've got menstrual irregularity, that's probably one of the main uses for it there, just to help to regulate that cycle length. And again, we would probably use other herbs with that to support it, but for some people, just Vitex on its own will do the job. Regarding monitoring ovulation, are there apps that are recommended better quality than others? Some people have used period trackers, which seem to be giving fertility window information based on the calendar method. I have yet to see a fertility app that I really love. But Fertility Friend seems to be reasonable. What I really like to see is one where you can do your temperature, and it's not so squashed up that you can't see the difference between the first and the second half of the cycle. And there's enough room in there to record lots of detail about your mucus, because the more you record, particularly initially, the quicker you'll learn to work out what your symptoms are and what your fertility pattern is, because you forget from month to month. You're not going to remember what your mucus was like on day 10 of last month. But if you've got good returnings, you'll start to get your understanding a lot quicker. I hope that answers that well enough. Any other questions or anything? No? Okay. But feel free. I think you could probably ask further questions maybe through the Fertility New Zealand website. And if you've got anything else you want to know, please get in touch. Over to Nicola.
Thanks, Jo. There are 2 more questions sitting there if you're still happy to answer them.
Yes, yeah. Any herbal medicine as an alternative to Elevit or Menivit? Well, herbs are different than Elevit and Menivit are multivitamins and minerals. There are other alternatives that you can use, but they're still nutritional. A herb isn't going to give you the nutritional support that they will, but it help, I guess herbs will help to normalize function and enhance and support you in different ways. And are these factors as important when doing IVF? Definitely. It can have a dramatic effect on your whole IVF experience, and I mean what I found in clinical practice is it does help your chances of success with IVF as well. And this is what I really encourage people, because you're usually with IVF you're waiting, you've got a waiting time of often 3-4 plus months, and this is something you can look at doing while you're waiting for to get onto the IVF or to start your cycle. So it's really important. Okay, thank you. Anything else? Is that too late? So somebody here's got a 29-30 day cycle but positive LH serve on day 18. Is it too late in the cycle for conception to occur? I'd never say it's too late for conception to occur. It is getting late because the corpus luteum doesn't get such a good chance to build up. I would never say never, but I would question, checking that your mucus is agreeing with that positive LH surge, because what we find is that, there's not necessarily always agreement for everybody. So always just make sure that they agree, and and then maybe you could look at some support for that second half of the cycle as well. Okay. I think that's all. Any more coming?
I think that's it for now. There's nothing else that I can see.
Yeah, that looks like all.
So thank you very much, Jo, for sharing your expertise tonight, and thank you to everybody who's joined the webinar as well. The rest of the program's up on the screen now. So the next webinar is Building Resilience During Infertility with fertility counsellor Fiona McDonald. That's on Sunday night. So thank you again, Jo.
Thank you.
And everybody else. Thank you. Good night.
Very well. Bye.